back to another week of child safety. This week we're going to be going over health and fever safety, as well as kind of talking about different kind of medicines, how to properly administer medicines, child-proofing, fevers, when to call a doctor, our safety sheets of stuff for numbers to call if there was an emergency, if somebody else is watching the child, as well as going over our first aid kits that were in our kits and discussing what's in them, how to use them, and when to call emergency numbers and first responders. So to jump on into this session, I just want to start off by saying that children getting sick is very scary. It can be very daunting. Obviously, nobody likes when children are sick and not feeling good, especially if it is the first time or the child is very young. So these are some tips and tricks that I hope everyone finds helpful, as well as helps take away maybe a little bit of panic if you notice that your child is developing symptoms or coming down with a cold. So to start off with, children should never be given aspirin. It increases their risk of Reye syndrome, which is a potentially life-threatening condition. So if the child is sick or developing a fever or has chills, aches, or sweats, we just want to be making sure that they are not getting aspirin and that they are given something that is prescribed by your doctor. A little tip is that if the child is receiving medication, or if they are receiving multiple medications, so maybe an antibiotic for a cold or a different symptom, as well as something to reduce a fever, my suggestion would be to keep a chart. That way we can keep track of how many doses a child is getting, so we don't double up on doses if we forget, or if a partner or babysitter or somebody watching the child while maybe you're at work or away knows that they got their morning dose and they aren't doubling up, so that way the child is getting the correct amount of medicine to prevent potential overdosing, as well as underdosing to make sure that the child is getting everything that they need. If the child is taking two medications, usually that there's a time frame of like a window that one is administered and then you maybe wait like an hour or two before you administer the other, so that there's no interaction, and a chart just helps keep track that the time frame is fine. If anything were to happen, then it's easy to tell a first responder that you gave a dose at this time and the other dose was taken at this specific time. That way they have an accurate description of maybe what could have happened if something were to go wrong. That way it just kind of keeps everybody on the same page when administering medicine. This is also very important if your child is going to preschool or school. That way teachers and anybody else who has to administer a medication knows that the child took it at this time, so they know the correct times to administer another dose, or to help provide an overview if the child is giving themselves medication like an inhaler or something of that nature. That can be the scariest is a child getting a fever. So a fever in a child is actually a positive thing. It means that the body is actively working to fight off infections and bacteria, in that the body is trying to protect itself. So don't feel obligated. Ibuprofen, just because if the temperature is around 100 degrees, accompanied by discomfort, so like shakes, chills, or sweats, because a low-grade fever of under 102 does not necessarily need to be treated, because it's just the body fighting illness. So that is actually a healthy thing, and the fever actively works to make sure that the child's body is getting healthy. So we want to give that a chance to kind of run its course at first, unless the symptoms again are discomforting and it's accompanied by chills, shakes, or sweats. So scary. Medication should be put off until you have talked to your doctor, just to make sure that it is necessary and a child isn't receiving unnecessary medication if it's something that maybe they need a different antibiotic for and the medication might be counterproductive. Prescribe something that is not interacting at all. So always check with your healthcare provider first before administering any medication, or using medication that maybe is left over from a previous illness. Like if the child is developing the same symptoms and they had an antibiotic previously and you have some left over, to not be re-administering that, because again, it could be expired. The symptoms, although similar, could be something else. So just making sure that you have that okay from your doctor before re-administering it. Or if you have multiple children in your care and they start developing the same symptoms, make sure that you take both children to the doctor so that they can get their own medication, because symptoms in one child, although similar, could be something else, and allergies, and we just want to be making sure that we're not mixing medications for different children. Multiple doses, so if, let's say, you have an antibiotic where you're required to take 4 doses a day, making sure that you talk to your doctor if your child is on a schedule, just to make sure that those doses do fit into a schedule. If not, if there's modifications that can be made so that the child can get their doses, while making sure that you're not rushing medicine into their schedules to make sure that they receive it, because again, that can cause obviously a higher amount of medicine in children whose bodies aren't able to flush the medication out as high as adults, and it can lead to the child getting sick on a schedule, and they do have to take an antibiotic multiple times a day, that we are communicating that to the doctor or pharmacist and asking what the best course of action would be. So tips and tricks for administering medication, as well as safety tips when giving medication to prevent choking and misdosing a child on their medication. So the first comes when you give your toddler medicine. You might find it easiest if the child sits on your lap because they might feel more comfortable, but make sure you just never let the child lay on their back as you're administering the medication, because they might choke. The other thing is that if you are providing a medicine through a syringe, the best place to place this end of syringe is at the side of the child's mouth, so this way it's not going straight down the throat where they can spit it out or not take it, as well as it provides the least amount of choking hazard as well. Most kids also think that the syringe is fun to use if they can push on it themselves, and it can be a fun way to make sure that your child actually does take the medication. Have a child's favorite drink ready if it's something that is being administered through a syringe or a pill that they do not like, because that way it can wash away the taste, as some medicine like Benadryl or Buckley's does not taste very good. But we just want to make sure that they do have something, so it's almost like a treat at the end, that they can wash it away and it's over with, so they don't have to be stuck with the nasty taste in their mouth for a longer period than they really have to. Another tip or trick is that if you're having a really hard time getting your child to take the medicine, is to mix the liquid medicine with a spoonful of applesauce. I wouldn't lie and say that it's just applesauce, because one taste, the child will know that it's not right, but just saying maybe that it's a way to make it taste better. Not to dilute it too much, just 1 tablespoon, and just give it a mix, so that way when they're eating it, they know that it is their medicine and it's just a way to make it taste a little bit better. And the less applesauce you use, the faster that it's over, so the child doesn't have to keep eating the medicine applesauce mixture. Another way is to pretend to give the medicine to a stuffed animal first. This used to be my favorite as a kid growing up, because that way they know that they could do it, you could do it, and it's all fine. And a lot of the times it's a way that they can see trust, and it's fun, and it just makes it a little bit more exciting to take medicine when it's already something that is not fun for anybody. So fevers are very common. They make children uncomfortable. They might not act like themselves. They might be more fussy, not wanting to eat. They could be very sad, very lethargic, fatigued, have the chills and the sweats, and be acting a little bit off, which can cause a lot of anxiety in parents and caregivers, because that's obviously something that we don't want to see. We want to make sure that the children are feeling safe and that they're feeling okay, but it is a normal part of life. It's the body trying to actively fight off any bacteria or any illness. If you do find that the fever is over 104 degrees Fahrenheit, that is defined as a technical fever. And if it is accompanied by the side effects, the child in light clothing, give them a cool bath, use a cool cloth, drink as many liquids to make sure that they're getting a lot of rest. call the doctor, see how they're behaving, kind of monitor their symptoms. But a lot of the times with a fever, it's just important to allow yourself to cool down. So a cool bath in a cool cloth, as well as lots of fluids and rest, go a long way. So when to call a doctor. So these are symptoms that warrant a call to the doctor, as well as should be monitored by yourself and whoever's in the home, just to kind of make sure that everyone's aware of kind of what's going on and what's happening, and so the doctor is aware of the best course of treatment to provide for the child. So if the fever is greater than 100 degrees, it's important to call a doctor. If it's accompanied by sweat or clammy skin, unusual and persistent crying, so if you notice that it's become more severe or it's not something that you're used to hearing, that is important to call. An injury that causes more than 15 minutes of crying. For younger children, crying is the only real way to kind of communicate at that stage, but if you find that you think a child may be injured and the crying has persisted for longer than 15 minutes, that would warrant a call. Disrupting to the eating pattern, especially if there is a complete loss of appetite, that is something that is unusual. Indigestion of anything that may be poisonous, vomiting or twitching fits, restlessness or activity, so a lot of fatigue, clear changes in behavior or their attitude or their movement, deep breathing, a very persistent cough, redness in the eyes or discharge from the eyes, which could be pus, discharge from the ears and ear pain that you may be able to recognize by the baby constantly turning its head or pulling on its ear. Those are usually signs of ear infection or other illness. And swelling in the front, the frontinals, which are the two soft spots on your baby's head. If something is on this list, it doesn't necessarily mean that you shouldn't call. You should always call if something that you notice is unusual or is making you anxious and you would like clarification from a doctor. That is always the most important thing. Always make sure you call. These are just the main tips and tricks of things that would probably lead to a child being sick or something greater that a doctor would need to administer an antibiotic or additional testing for, and the child is having difficulty breathing or it's something that is more alarming, you want to make sure that you are calling 911 and getting that taken care of right away instead of waiting for your doctor. Safety list on the fridge for if your child has allergies, a medication checklist, as well as doctors and emergency numbers if you were to have a babysitter or somebody over who is watching the child while you are away. We have our first aid kits, so these are important if the child were to get hurt, get a scrape or a burn, is not feeling well, or you are trying to wrap up a wound before a first responder gets there, or if you're out and about before you can make it to a doctor. So these kits, I wanted to make sure were very portable, that these can be thrown into a backpack that a child could take with them. Could be thrown into a purse, in the glove compartment of a car, could be easily stored in the home. This could honestly even fit into a pocket. I just wanted to make sure that these were very accessible and on hand, because some first aid kits are big and bulky and you're not able to reach them or bring them with you, but with these you can always pull it out and have it with you. So in our first aid kit, we have a pair of tweezers. So tweezers can be used if you are pulling something out of a wound, maybe glass, hair, holding it as you are applying pressure. It could be used to help pull bandages if you want to make sure that your hands stay away. Tweezers can be used for numerous things, so these are always important to have in a first aid kit. Next, we have our bandage and our scissors, as well as our tape. These three usually go together. So we have our bandages, our scissors to cut the bandage, and or clothing if needed. If you have a deep wound and you need to cut around it, you could do that, as well as cut the bandage to the desired size, as well as tape to wrap a bandage, wrap something around the wound to make sure that we are applying pressure and to keep it from obviously getting infected and bleeding. Q-tips, which can be used for multiple things, to clean a wound, to help get something out of a wound, to make sure that we just have these. These are very important for cleaning areas. Next, we have our Iodine Q-Tips. So these are good antiseptics to help prevent infection before we do a wrap or a gauze. These ones are very neat because what you do is you take them out of the package, and as you can see, there is an orange line. So at that orange line, you are going to break it off completely, and the iodine is going to run to the bottom of the Q-tip. At this point, you can apply it to the wound, and it is going to make sure that it is nice and clean before it is wrapped up. So again, you just break the top off, and it allows the fluid to run to the other end where you can keep it nice and safe and discard properly. Next, we have alcohol pads. Again, these are good for cleaning wounds, cleaning the areas to prevent infection of open wounds. We have a large bandage. So this just goes over wounds. It is sterile unless it's open, single use. And we have Band-Aids in case we need them for any cuts, tips, or tricks. So this first aid kit, while basic, should help with any kinds of falls, major cuts, burns, infections, until we are able to get seen by a doctor, or before we are heading to an emergency room, or just things to have in our house. That is a good tip and trick. So again, I love how portable these are. These can go into your kids' backpacks. They can stay in their house, around the room. You can keep them in your purse, in your glove box, to your car, as you're going out and about. These are very amazing, and again, I love the size and portability of them. So that is everything. Again, just making sure that everything that we take in this video, that we run by our doctors, and that as amazing as tips and tricks are, doctors' opinion should always be number one, and that we're really counting on that, and in the case of an emergency, to always call 911 and get first responders and emergency services. So that is it, guys. I hope that this helped a little bit and that you guys really enjoyed child safety, and I would love to hear back from you guys, and I hope you guys had a great session, a great workshop. This session, I know, is full of a lot of talking, and it's a lot of information, and it can be very daunting, but what's great about virtual workshops is that we can always look back on them and kind of save little tips and tricks and write things down, take worksheets, and I have included a lot of resources in our kits, so that way there's a lot to look back on, so we don't have to remember everything that is said. So I hope you guys learned something. I hope we all learned something together. I learned a lot putting this together, and I hope you guys enjoyed it. So stay safe, stay happy, stay healthy, and I will see you guys in the next workshop. Bye, guys.